We welcome you back as we continue with our Monday program here on Channel 6. Our good vision always very important that we all keep our eyes working well. And Dr. Salib back with us today to talk about that. Welcome to the show, sir.
Thank you.
Good to have you with us. Today's topic is a unique one. Face it, over the years, having been here a number of years, I've had a lot of interviews with medical folks. And one of the things that we talk about a lot with you ophthalmologists is cataracts. It just seems to be a reality of aging. For those that have never had that experience or have yet to have it to deal with it, real briefly, what is a cataract?
Well, every eye has a lens, much like the lens of a camera, that allows us to see clearly and focus on what we want to focus. So with time, there's proteins that aggregate or clump together in the lens and causes clouding of the lens. And so a cataract is basically a clouding of the lens that doesn't allow us to see as clearly as possible. And you can see a picture of that up on the screen here, where you can see this clouding of the actual lens.
And my understanding is it's a natural occurrence and there's not much we can do to prevent it, correct?
Exactly. The most common reason people get cataracts is time or age. So if we live long enough, we're definitely going to get cataracts. And in fact, as we age, the incidence of cataracts increases. So by the time we're in our 70s, about 50% of us will have cataracts. By the time we're in our 80s, about 70% of us will have cataracts that are visually significant. There are other causes as well, such as diabetes can increase cataracts, oral steroids can cause cataracts such as prednisone, trauma, but the most common reason is birthdays.
So for some people it could be in their 40s, but for most of us it's going to be in our 70s or 80s, almost for sure, that we're going to have to cope with it.
Yes, exactly.
All right. So how do we tell? It sounds like it's something that takes place over years and years and years, that gradual change in our vision. Does it have to get to a certain point? Do the people come to you, or do you find it in the exam room?
Well, usually if they haven't felt anything or seen anything, I'll sometimes see it in my exam room, and I'll tell them, well, you have the beginnings of cataracts. When people come to me and tell me, you know, I can't see as well, please change my glasses, I'll change their glasses. They come back a month later, I still can't see well out of my glasses. That's a common sign that you have a cataract if you're frequently changing glasses. Another thing people tell me is they have difficulty, for instance, doing things such as driving at night. Maybe it's a little darker, or they can't see quite as well because of the lights flashing in their eyes. The lights cause scattering of the light. They see halos. So that's often also a common reason people will come in. Or they sometimes just say they can't see quite as clearly in general, whether they want to read, if they can't see the golf ball, the tennis ball. You can see here a picture of a normal eye on the left, where you see a clear image because you have a clear lens through which you're seeing. On the right, you can see the cataract, and the cataract eye scatters the light so that the retina, which is the back of the eye, doesn't get a clear image, and you see it blurry.
I guess the problem is it takes years and years for this to develop, so we sort of accommodate everyday activities, whether it's driving or playing with our grandkids or whatever it might be. It's sort of just over time and eventually. But of course, getting an annual eye exam, you can spot this maybe before it becomes real problematic. Well, we know that for years they've been dealing with it, and I understand that it's actually in England, I think, after World War II or around World War II, they found that some of the pilots had little chips of plexiglass where the bullets had hit the plexiglass and on the airplanes, and little pieces that stayed in their eye, so that the eye will tolerate, to some extent, some foreign things in it on a permanent basis. That's kind of how they developed the lens inside the eye. Is that correct?
Yeah, exactly. They found that for the fighter pilots. They found that material didn't really cause much damage, so they decided to try and develop a lens that you could put in the eye for the person to see. They used to just take out the cataract, and then you'd have to wear those big Coke bottle glasses in order to be able to see.
So they put the lens in, but I guess part of the procedure is getting the old fuzzy part out, so to speak, and my understanding is you've got some new techniques. Using a piece of equipment you've used for something else for years, you're now able to use that to help get that old lens out of there.
Right, exactly. So in the traditional method of taking out a cataract, we use blades and bent needles basically to do the incisions in the cataract itself, in the cornea, in order to get at the cataract. And then we use something called phacoemulsification, which is the machine that actually breaks up the cataract using ultrasonic energy, and then we put in the new lens. So now we've been using a technology called femtosecond laser technology, where we've been using that for all laser LASIK, where we create the flap. But now we can use that same precision to do the incisions for the cataract surgery and the circular opening in the front of the cataract called the capsulotomy, and we can even soften the cataract itself to lessen the amount of energy that we use during the cataract surgery.
Why do you feel that's better than the, shall we say, the standard way of removing that capsule?
Right. Well, while a seasoned surgeon is very good and he has nice steady hands, he can never be quite as precise as a laser. So with this new laser technology, we have video-assisted technology where we can actually see the layers of the eye on the screen through something called optical coherence tomography. And then with that, that basically gives a good map of the eye. We can precisely tell the laser where we want it to cut, how big the incision we want it to make, and exactly how big the capsulotomy we want to make, which is that opening in the front of the capsule of the cataract, and we can actually break up the cataract. They've done a study where they found that out of 250 patients, 43% of the time they had a 43% decrease in the amount of energy used to break up the cataract once they broke it up with a laser, and actually were able to do it in 51% less time. And also in terms of the capsulotomy, the manual way of doing it compared to the LASIK, the laser method, only about 10% of the time were we able to achieve the same precision as with the laser.
So even though the doctor is well trained and skilled, the equipment can help. And modern technology, we're seeing so much of that arthroscopic surgery these days, lasers being used in lots of ways, but obviously for the eye as well. Are all patients good candidates for this, or are there some people that would do better than others in this particular procedure?
Right. Well, with every case in terms of surgery, we have to look at the individual case. But certainly this can benefit a lot of people. It especially helps those people who have astigmatism. So astigmatism just means that the front of your eye is not completely round. It's kind of like if you look at a spoon and you look at your image in a spoon, you'll see how your image is a little distorted. That's astigmatism. So this laser is great for that because we can actually plan the astigmatic incisions in the cornea with the laser instead of doing it by hand. And on top of that, this is especially good technology for those people who choose those lenses that are not the standard lens. For instance, what we call the lifestyle
the focusable
lenses. Right.
Focusable lenses.
Yes,
yeah.
the multifocal lenses, the toric lenses. All those lenses achieve the best results when you have good astigmatism correction.
Good. Sounds like something you folks would want to ask about if your doctor is saying to you, hey, your cataracts are coming out. You need to get those dealt with. This might be the next technology and something that might be helpful to people that want to find out more. They can contact your office if they want to get that exam taken care of.
Sure.
And they also can, of course, get taken surgery as well. 770-1322, they can give you a call and find out more. I understand also with 250 clubs here meeting all year long, they always are looking for guest speakers. I understand you'd be available to speak to some of our clubs.
Yeah, certainly. I'd be happy to come out to your club and give you a talk about any eye topic you choose. I am always interested in educating and talking to the residents of this town.
Sounds good. So if you would like to find out more, again, you can give Dr. Salib's office a call, and his staff will get you scheduled in between laser surgeries and cataract removal. He'll try and come and speak to your club and organization. Thanks for joining us today. Good to have you with us.
Thanks for having me.
See you back here in a few weeks. Thanks for joining us today. Dr. George Salib, again, topic today, laser cataract surgery. Very interesting new technology. We'll be coming back with more guests as our Monday program continues for you. Stay with us.